Hello, my name is Taya Graham, and welcome to the Inequality Watch. As you know, we created the show to examine and call out the purveyors of the extreme income inequality that plagues this country. We do so because it is an existential issue. We also focus on economic inequity because, as you might remember from our last show, the mainstream media perpetuates many of the myths that not only make it possible, but maintain it. And it's that myth-making which bolsters a system that promotes and abets global warming, unaffordable health care, mass incarceration, and every other social ill that poses a fundamental threat to lives and livelihoods for the people of this country and the world. But at The Real News, myself and my reporting partner, Stephen Janis, constantly evaluate how we report and what we report on. And based on some recent developments in this country, we decided to shift the focus of the show just a bit. The change is both thematic and topical. I'm talking about healthcare. It's a fundamental human need that the richest country in the world has turned into an industry, a greed machine, which plunders people at the altar of the bottom line, contributing to the worst of both worlds scenario, where we pay the most money for the worst outcomes, which is why for the time being, we're going to focus on our inequality reporting on the healthcare industry, not just the lobbyists and the overpaid executives, the politicians who take their money and the schemes to fleece the sick, but also on you, your stories, and how this overpriced, inefficient system has affected your lives. If you have had an experience with the healthcare system that has harmed you and you have evidence of it, let us know and maybe we can tell your story. You can contact me through my social media at Taya's Baltimore on Facebook or Twitter. And of course, you can reach us directly at therealnews.com. Now, back to the healthcare system that literally taxes every man, woman, and child $8,000 per year, whether they use it or not. How do I know this? Well, thanks to two Princeton economists who just released a report that concluded exactly that. They examined the numbers and determined that we all pay $8,000 annually to fund this bloated, inefficient, and unresponsive healthcare system because it is so infused by greed and excess. But the question is why? Why would the wealthiest country on earth accept this kind of poor performance, especially for a nation that continues to extol the virtues of its own virulent brand of capitalism and thrift? Why can't the supposed wonderful system of enterprise and innovation deliver affordable and effective health care? Why can't the wealthiest country on earth provide the most basic human needs to its citizenry? Well, I have an answer, and it's pretty simple. Greed, of course. And it's literally killing us. That's all it takes to explain why our healthcare system is not in fact healing us, but instead harming us. Why every time progressives like Bernie Sanders and Elizabeth Warren discuss Medicare for all the mainstream media talks about is taxes. Why incremental reform of Obamacare will never work? It's all due to greed. Here are the numbers that the Princeton economists used to determine the value of the so-called tax that every single American pays for the burden of our greed-infused system. Our healthcare system cost $1 trillion. That's with a T, $1 trillion per year, more than any other country in the world. And here's where the greed part comes in. The economists noted that 16% of the country's top 1% are physicians, and they noted American physicians get paid twice as much as their European counterparts, where the healthcare outcomes are much better on average. In fact, the two Nobel Prize winners blame this overpriced healthcare system on this: the rapid and disheartening increase in the deaths of despair. The graphs show the alarming increase in deaths of suicide, liver disease related to drinking and drug overdose deaths. All, the authors say, is part of the result of a system that denies mental health services and overprescribes opiates in the ruthless pursuit of profit. But on this show, we don't just report statistics or recount academic findings. We go out in the world and reveal and expose the hidden inner workings of this absurd system. We show, not just tell, and we ask the tough questions. Put simply, we seek to hold the purveyors of this unworkable system accountable. And to do so, we ended up traveling here to the state capital of Maryland, Annapolis, and the first ever meeting of a unique board that is the first of its kind anywhere in the country. I'm talking about the first state-sanctioned Prescription Affordability Board, a committee ostensibly tasked with investigating the high price of pharmaceutical drugs, a group that is supposed to find ways to tame drug prices in a country where diabetics can't buy insulin and EpiPens that prevent people with allergies from suffering catastrophic reactions cost roughly 1,000 times more than the price of the medicine itself, all while a few top executives at these companies make tens of millions of dollars per year. But like many legislative initiatives that purport to offer actual solutions, it didn't take long for us to learn an extremely important fact about this alleged lifeline for skyrocketing drug prices. That's because when we showed up with our cameras, we immediately recognized that the leader of the so-called board had some very interesting ties. Stephen, can you elaborate on what we saw?
So the leader of the board, the person who was appointed by the governor, Larry Hogan, Van Mitchell, was a former drug industry lobbyist. He lobbied on behalf of pharmaceutical companies, was paid quite well for it, and even got into some trouble for it. So right away, you have a board that's supposed to be looking at prescription affordability, where a guy who has profited off the lack of affordability. So immediately we were like, okay, this is really kind of a sham. If you look at it, there's no way, how can a lobbyist run for a board that's supposed to help the public?
And that's not where the story ends, because it turns out Mitchell was involved in what some would call a very questionable deal involving a pharmaceutical company he represented as a lobbyist. So Stephen, talk a little bit about this pharmaceutical company.
Well, when he was head of the Maryland Health and Human Services, he substituted a life-saving medicine for heroin addiction called buprenorphine with another drug called Zubflof, which was not as popular and not as easy to administer, but he had represented the firm Zubflof as a lobbyist. So he made this switch where he said, you can't give buprenorphine to Medicaid patients in the state. We want you to use Zubflof. And a lot of people push back because people are used to their medication. And of course, everyone knows the opioid epidemic is fraught. You know, people are dying every day. So
and Maryland has an incredible number of overdose deaths as well. So people really need this medication.
And so it was, and Baltimore has some of the highest in the country. It was catastrophic in the sense that it shook up a system that was, trying to help people. And because he had represented this firm, he got into a lot of trouble because he said, oh yeah, let's use this. And he had ties and he profited. It was a classic case of how lobbying and greed-infused politics creates bad outcomes for people and patients.
But we didn't just show up at the state capitol to watch. We questioned Mitchell about his ties to Big Pharma and how he thought it would affect the management of the board. Let's listen.
To be fair, when you were health secretary of Maryland, you did work for a lobbying firm that did lobby for Zubflof. Do you think that raises concerns for people? Are you going to disclose that? How are you going to handle that?
Well, we made the decision, I did as a board chair, to make sure that we were disclosing on the financial, and that's why we had Mike Lohr here today. So I have no problem. I've never had any problem in my 25 years disclosing whether I've been in the House of Delegates or at the health department or here.
Do you feel that ties to pharmaceutical, do you feel like your tie to the pharmaceutical industry at all would be a problem for you? Or?
No, I actually feel like it's an advantage because I've worked in all the sectors.
So, Stephen, am I hearing this correctly? That a lobbyist is telling us the fact that he was a lobbyist for a drug company is actually an advantage? It's something good that's on his resume?
That was his interesting thesis, was that my ties to the drug industry, the fact that I profited from gouging customers with drugs, makes me the perfect person to lead this board, and maybe he's making the correct case, right? Because maybe
he knows how bad the system is and how crooked it can be.
Maybe we'll see what this board does, but my feeling is they're not going to do anything, and so maybe the perfect thing is to put like the fox, in charge of the hen house, right? Because he is going to be the sort of the gatekeeper on what drugs get examined and what sort of remedies are proposed to the legislature. They're supposed to have some real power, so yeah, maybe he is a perfect person based upon his experience of screwing people.
But it also seemed like the entire hearing room was crawling with lobbyists. So as you can see, we have our work cut out for us. If the so-called Prescription Affordability Board is not just surrounded by lobbyists, but is actually run by one, it's a clear sign that the future affordability of American healthcare is fraught. In fact, we spoke to the former president of Healthcare for the Homeless about the purview of the board, and he told us it can only look at a small segment of exorbitantly priced drugs, not more widely used medications like insulin.
It's a very pallid kind of attempt to do something, but not much. There are 100 ways of trying to address that problem, and in Maryland we found one that probably won't do much. The mission of the board and its regulations, I think, won't permit it to do a whole lot. There might be some cost savings in very expensive drugs, which isn't a bad thing, but for most people who aren't paying for $30,000 a year drugs, but instead we're paying $300 a month, and we can't afford that, this won't do anything.
So what does this all mean? What does this one-of-a-kind board, staffed by a lobbyist, and its limited powers say about the political economy of the country's healthcare industry? Well, to answer that, let me introduce a bit of news that was widely reported by the mainstream media, but was mischaracterized at best. Last week, failed presidential candidate Hillary Clinton was widely quoted as saying that no one wanted to work with Bernie Sanders in the Senate and that he wasn't very popular. It was a critique that was widely embraced by the mainstream media as further evidence that Sanders' radical breed of socialism has no place in the reasonable, august body of the U.S. Senate. But Stephen, you have a different take on this. Can you share it?
I mean, it's amazing that people would call an august body that approved the Iraq War, that could not pass a public option when the Democrats had 60 senators, that could not pass a surprise medical expense bill at all because of lobbyists. There's nothing, being unpopular there should be a credit to Bernie Sanders. Being unpopular amongst people that can't pass bills that would protect the American people, that would provide health care and humanistic policies that protect the people of this country should be a badge of honor. He should wear it everywhere.
Absolutely.
No one like me in this place that actually funds wars but not health care. You know, that funds, that actually too in this chamber was also many of the people like Joe Biden were the people that were the architects of mass incarceration. So let's add that to their cap. So if you don't like the fact that Bernie Sanders doesn't support this stuff or that people don't support it aren't popular, well, you know, screw them. Because it makes absolutely no sense that someone should be ashamed of not being a fellow conspirator in these kind of horrible policies that are killing Americans.
You know, you're right. He should definitely consider it a badge of honor that he can't be lumped in with the popular crowd of Democrats who have essentially sold out the American public.
But it shows how arrogant the mainstream media is and the Democratic establishment is, that they would say that disagreements over, that we have been the purveyors of this horrible policy, that we can't provide health care for our people, but we can fund $2 trillion of a war. And then we're going to go around saying he wasn't friendly with us, he wasn't collegial. It's like Biden saying, I was friends with Ku Klux Klan members. I'm so proud of it. I mean, who cares about that? It's the policy that matters, not whether you get along with your colleagues across the aisle. That bipartisanship doesn't mean anything if it produces bad policy. And why should we worry about that? And why should Hillary Clinton? And healthcare, you know, literally, they had 60 senators and Democrats, and they couldn't pass a public option.
That's right. The group of politicians that brought us the Iraq War, the Great Recession, welfare reform, and mass incarceration says Sanders is not a team player, that his radical notion that healthcare should be a human right, that the healthcare system should heal, not bleed its patients, that big pharma should be able to extort diabetics for a drug invented almost 100 years ago, just doesn't play ball. Well, guess what? The real news doesn't either. And we might not have all the pharma advertising and corporate marketing dollars of the mainstream media, but we have a more valuable asset that we intend to use, and that's integrity. That's because without the corporate funding, we can, in fact, speak truth to power. And we plan on doing so to all the high-paid lobbyists and greedy healthcare executives and the politicians they buy and pay for. We promise on the show to expose and examine how the system they have constructed not just harms the people, but has contributed to a social malaise that is far too costly to estimate, that their unhinged greed and lack of compassion for the people of this country who deserve dignity and sanctity of effective health care will not go unrecognized. We will continue to report on your fecklessness, and we will work tirelessly to expose how you profit off the suffering of others. I want to thank my co-host, Stephen Janis, for his amazing reporting, scripting, and editing. My name is Taya Graham, and I want to thank you for joining me for this episode of the Inequality Watch.